Before we get started exactly, I just want to bring up something. We've had a few questions over the last night and today about, do I need to be seen at one of these clinics? I mean, I'm doing okay. I have a doctor in wherever. And need and recommendations are not exactly the same. What I would say is I think it's reasonable for anyone with CMT to be seen at least once in one of the centers that really know what they're doing with the disease. So clearly here it's our center and the Stanford Center in terms of CMT. Some muscular dystrophy clinics have people who are knowledgeable in CMT if you didn't want to make the trip to one of the centers of excellence of the CMTA. But I personally think most of us don't bite. I don't have to do the electrical tests if you don't want them. So it's usually not a painful experience. And usually, most of our patients find it very helpful and educational. We do recommend in general for people to consider coming back once a year. In terms of our research, we are interested in tracking the progression of disease in each of the genetic forms, and that's one of the things the RDCRN is doing. So we do recommend that. So my recommendation is if you have CMT, it's worth going to a center, particular center of excellence, at least once, and then you decide how often you want to come back. So on that note, it's been wonderful seeing Dawn again, because we've missed her for the last few months. She had a baby boy on December 9th, which is...
Thank you.
December 9th is the best day to be born. It was when I was born. And she's back here just for you today to talk to you about some of the physical therapy aspects of having CMT. So Dawn, congratulations.
Right. Thank you. All right. Well, as Dr. Lewis mentioned earlier, there currently is no cure for CMT, but there's a lot you can do to address symptoms and improve a person's independence and function. I'm going to talk about physical therapy, what PTs are, common presentations seen in CMT, and then what an evaluation and treatment would consist of.
Everyone here? No. If you move the mic, there you go.
Okay. So we are members of the healthcare team who work with patients to maintain, restore, and improve movement, activity, and health, and to optimize a person's function and quality of life. We also educate people on the use of walking equipment and other assistive devices. So basically, we are the experts in human movement. So symptoms that have already been addressed, but we talked about the hammer toes, clawing of the toes, the high arches known as pes cavus, the heel turning inward due to poor muscle control, the muscle wasting, also known as atrophy, the little muscles in the foot and in the front and outside of the leg, as well as in the hand and the forearm, often at the base of the thumb as well. And there's a tight Achilles tendon, causes a person's heel to come off the ground. Decreased stability at the knee. Sometimes there'll be a buckling of the knee or even snapping the knee back, which is known as hyperextension. You see all different kinds of abnormal walking patterns like foot slap, foot drop, high steppage gait, and a waddle. There's often cold hands and cold feet due to decreased muscle mass, decreased activity and circulation, and difficulty balancing and standing still. So with the evaluation, we'll look at pain, lower extremity alignment, functional movements, balance, your walking pattern, range of motion, strength, and any equipment that you may or may not need. So pain comes from two sources. The musculoskeletal is what we can, with physical therapy, help you the most with. Overstretched muscles, known as strains, or overstretched ligaments or sprains. Common sites are in the ankle and foot, knee, and low back. Then there's the sensory neuropathy, nerves for sensation that do not function properly, often foot tingling and burning pain, and these are often managed most with medications. So we'll look at how a person stands. We talked about those with CMT can have changes in their posture due to imbalance in muscle strength, and early intervention is ideal to reduce a person's risk for deformity. So we'll look at the way people move. We'll watch them move from sit to stand, squatting, going up and down stairs, because we want to teach them how to become more efficient and reduce the pain associated with these movements. So a change in a person's walking pattern may be one of the first symptoms noticed by an individual or family member. Weakness and decreased sensation in the foot can contribute to the foot slat or inability to clear the foot with swinging the foot forward, known as foot trot. People with foot weakness may use their hips and knees to help clear their feet when walking. This walking pattern is sometimes described as like a high steppage gait, or with the trunk lean is a waddling pattern. Weakness often causes decreased stability of the lower leg, which can result in the knee buckling or the snapping back, and walking deficits can result in an increase in fall risk. So weakness and the reduced sensation seen in patients can impact a person's balance. Calf weakness is the greatest contributor to balance problems, and we'll assess and, if necessary, address these balance issues to help decrease your risk of falling. Assistive devices such as canes or walkers provide an increase in balance and confidence, help with energy conservation, and are a tool to promote freedom and safety. They will not make you weaker. CMT impacts muscle strength and can cause muscle wasting. Sometimes it's common to overuse your muscles, so you'll see signs and symptoms of overuse such as cramping, burning, twitching, fatigue. A rigorous strengthening program is not recommended for muscles impacted by CMT. It could be harmful to the individual. So proper exercise can minimize fatigue and improve a person's ability to get through the day with more energy. So usually we'll address stretching, strengthening, and cardio. Stretching should be done to promote muscle balance and reduce the possibilities of poor alignment from developing or progressing, and to reduce deformities, injuries, and pain. So guidelines for strengthening are low to no impact, low resistance with increased repetitions. It's best to consult a PT to develop an optimal strengthening program to reduce the risk of injury or harmful consequences. So for cardio, once again, doing low impact, so things like the elliptical, rowing machine, stationary bike, and swimming are great. Also being aware of overuse symptoms. So we're so lucky to have Swiss Balance here, but I just wanted to give a couple points about orthotics. The goal of orthotics is to provide stability in the affected joints. Braces improve muscle efficiency, decrease injury, and prevent or reduce deformity. And contrary to common belief, the use of orthotics does not make you weaker. So once again, I just want the take-home message is just to listen to your body. You're truly the expert in how your body feels. You want to seek professionals familiar with CMT. That's why you're here today. Consult a PT to identify and learn about appropriate exercise, activity, pacing, and equipment. Please consult with a physical therapist familiar with CMT at least annually to evaluate your exercise program. So any questions? So I'm not going to be here for the panel for the questions afterwards, so I have some extra time. If anybody wants to ask any questions now, feel free. Yes, gentlemen.
Is this on?
Yes.
Okay. Now, you said that rigorous exercise program is not recommended on the affected area. Is that correct?
Yes.
Now, CMT does not affect the entire body.
Right.
So if done in a safe manner and the areas are secured, could the other muscle groups be worked out vigorously?
Absolutely. A lot of times we'll address like core strengthening and strengthening of more of the proximal muscles.
Hi, my daughter currently gets her PT and OT through California Children's Services, as I'm sure probably many kids do. Do you or anybody in the CMTA reach out to California Children's Services, provide any training for them on this? Because a lot of the therapists there were not aware or had not heard of CMT when we started.
I just want to make sure I understand your question. Do we do any training for physical therapists?
Or maybe it's more of a question for the CMTA board. Is this something we could do to provide some services for them to make them more aware? Because that's where, you know, maybe other kids are getting physical therapy too.
Right. So hopefully things like the conference here and things like that, people will become more educated, as well as when anytime we have a patient come see us, I try to teach them the basics so that if they need to attend physical therapy closer to home, they'll know what to look for and maybe even educate the therapists themselves if they're not aware.
Could Pat Livney address that question about physical therapy? What exactly was the question?
No, that's a great question. I know, I don't know if Susan's in here, but we're certainly trying to address not only educational portion of that, but physiotherapy throughout the country, and they're going through changes. At the end of the day, it's imperative that when, you know, we're a big believer in physical activity, but physical activity up to a limit. And I always say, don't break a bone. That's your limit. At the end of the day, when you go see a professional, they have to understand what the disease is. So when they give you that physical activity, they know that they're not doing any more harm for that. So we're working on the education part, as well as trying to get some videos done too.
Let me just say that one of the things we do in the clinics is when you see the physical therapist, we know that you live 200 miles away or 50 miles away. We don't expect you to be coming back here for your physical therapy. What we try to do is develop a plan for you that you can take home with you, and then we are available to communicate with your therapists wherever you live. But I agree, it would be nice, and maybe we can work something out in California to start training people. Just one other thing, someone lost an earring. I found it on the floor. Whoever it is, I have it.
Oh, yeah.
You listed some symptoms of overuse. What is the best way, other than not overusing your muscles? How can you treat that? Because at night I get, you know, the cramps, the jumpy leg, all those things. Thank you.
Well, one thing would just be energy conservation, trying to plan your daily routine or your exercise so that you do not overuse. So it really depends on the individual. Sometimes some of the cramping can be relieved from some gentle stretching. So just like I say, really being in tune with your body and knowing those symptoms. If you do have those signs of overuse, then trying to rest and take it easy. Yes.
Hi. I realize you just mentioned that there's going to be videos and to see a physical therapist to come up with a specific plan per the individual. But are there maybe generalized stretches or a list of these type of activities that is available maybe online or something?
I'm not sure. You know, each patient is individual. You know, we can't group them into like a cookbook. But like I mentioned, one of the common signs is to have really tight Achilles tendon, so stretching the calf. We saw in Dr. Pfeffer's video with the jogger leaning up against the car, he was stretching his calves there. So that's a really common calf stretch. But it really varies on each individual, how you present. So we would have to assess you individually.
Can you put the symptoms back up for me, or like the signs of over? Because my body in particular varies from one day to the next, and I don't always know till it's too late. So it's.
Let's see. So find that. So we wrote cramping, burning, twitching, fatigue. Those are some of the symptoms.
So are there any symptoms that come before that? Because I don't feel that coming, and then all of a sudden it's way too powerful. So are there any smaller things besides that? Because by the time I start feeling those, it's intense.
It's too far along. You're
Right.
So I would just be mindful of how much activity you've done, and then just trying to cut it back so you don't get to that point where it's just, over the top or too much pain.
Hi, I'm wondering if the center is doing any research in alternative therapies, like there's been a lot of research on the benefits of, for example, Tai Chi and balance. And then there's a therapy also called Qigong that has a series of exercises meant to reach the extremities in an alternative kind of science.
Well, I haven't seen any studies relating Tai Chi specifically to CMT, but I agree. We have seen a lot of research that those kind of activities definitely improve balance. So I think those would be great, and especially since they're low impact. I think that would be a great another form of treatment.
I do know that the RDCRN is working on a research project on types of exercise and therapy and its benefits. I don't know if it's going to reach all the ones that you mentioned, but there are people trying to look into this because there hasn't been a lot of research on this. And we clearly, by the questions, we know it's an important aspect of dealing with the disease. Oh, this does work, okay. So this is being looked into, but the alternative ones, to some extent, we need those people who are promoting it to work with us or demonstrate it, not just in CMT, but in other disorders as well.
I'm a long-term cyclist. I've recently been diagnosed with CMT, and I've noticed in recent times where the anterior tibialis in both legs, after I've gone out and cycled 20 or 25 miles, burn, kind of have burning in them for 12 or 24 hours, and then it dissipates. Is that a problem?
I mean, definitely want to respect your body, and I say you're truly the expert in how your body feels, so you know better than anyone. But yes, you don't want to, I would try to avoid the burning. There is a possibility sometimes that certain braces can actually give you a little bit more support so that you can continue the cycling, and it would just increase your stability and possibly reducing that burning feeling.
My question is going to try to tie your presentation to Dr. Lewis's presentation on axons. To what extent does physical therapy also accomplish neurological training in our bodies to get the signals from our brains to our extremities, and particularly for things like balance, to make us function better?
Right, so we'll give you all kinds of different balance exercises and activities to improve your balance. We have seen that really at any age you can regain balance, just as long as you're actually doing balance activities. So it takes some time to improve, but we'll do a variety of different balance activities to help with that.
Let me just add to that a little bit. Your question is, do you actually train your brain does therapy help your brain? There is a feedback mechanism that probably does play into it, but I think we need to be aware. Physical therapy and exercise is not going to fix the neurologic deficit. We don't overcome the disease by exercising and thinking that if I do 12 hours a day of exercise, that somehow my CMT is not going to be there. Does not happen, and potentially trying to over-exercise becomes potentially an issue. Joint issues, injury issues, and potentially long-term muscle energy issues. So exercise is important, stretching is crucial, being active is everything we want for you, but you need to be a little cautious about thinking that you're going to out-exercise this disease. Unfortunately, it doesn't happen.
Okay, you were talking about, or was asked about alternative therapies. How about acupuncture? Any studies done on if acupuncture at all helps? Or nutrition? The dietary and the nutrition with they're down in San Diego, there's a Center for Advanced Medicine with Dr. Bill Kellis, and I know that he is anxious to work on stuff like this.
Do you want to address that?
It's not quite a physical therapy, so I'll take that for Dawn. Acupuncture, it's been tried in a lot of things, and I think certainly for some people in pain, acupuncture has some benefit. Which acupuncture, who does it, what kind of pain, I don't think it's very clear to me which one works, but I've had some patients who've gone through acupuncture who feel it's helped them. And as far as I know, there's no long-term negative effect of trying it. So my feeling on these things is no, we don't have answers, but it doesn't sound like it's dangerous or harmful. I don't think it breaks the bank. So if you feel that's something you wanted to do, it's fine. But again, I don't think acupuncture is going to do much for the disease other than potentially treating pain. Nutrition, there's no evidence that nutritional supplements or natural substances or homeopathic medicines are going to affect the disease. There have been a number of things that have been looked into in neuropathies, including CMT. So far, there's really no evidence of any of it being particularly helpful. Good diet, reasonable vitamin intake is appropriate, but I certainly don't recommend that you go too far in taking too many vitamins or any specific nutritional treatment.
Just B12
You know, the fact is, if you have normal B12 levels, taking more B12 goes in your urine. So every dollar you spend on that B12 pill goes in your urine. And copper, again, yes, copper causes a myeloneuropathy similar to B12 deficiency, but if you have a normal B12 level, taking more copper may not be good for you. I don't think anyone knows that excess copper is appropriate or good for you, so I wouldn't necessarily recommend it. You need to be cautious. One of the things I'm always impressed by with my patients, not just in CMT, they don't want to take medicine that I prescribe for them, but they're very willing to spend $500 a month on stuff that they don't call medicine, but is equally as medicational and equally as potentially harmful as the medicine that I'm going to prescribe that I can tell them what it does. So I think we just need to be a little cautious of trying. This is a California, you know, it's all over the country, but California loves this stuff. And so I sometimes am fighting a losing battle here, but at any rate.
Oh, yeah.
Hi. This is really a two-part question, and first part is more a comment than anything. You mentioned, as we all know, that CMT does not genetically affect other parts of our bodies, but it does in terms of, you know, our gait and, you know, the way we use our bodies. So maybe you can make a comment about that. And the second part also is a comment also that I've recently started to work with an osteopath for pain, and that's been very helpful.
Oh, wonderful. I don't think I necessarily mentioned something that genetically it doesn't affect the body. CMT typically affects certain muscles more distally. We talked about in the feet and the hands and things like that. So we talked about addressing more, proximal muscles or the core, strengthening like that. But you're right, it does affect. Does that make sense, or did you have more question to that? Okay.
Hi. I was just curious about Rolfing and structural integration. I know massage therapy is often part of the physical therapy regime. And I'm just curious if there's been any research or any synergies with the Rolfing Institute on looking into helping with pain management through Rolfing. You know, it's been very effective with spinal, scoliosis and various other types of disorders. And kind of leading on to what you said, your gait, your knee bone's connected to your thigh bone, and when you start to compensate, then you have the other knock-on effect from this disease, and it seems like Rolfing might be a really beneficial thing. Have you worked with that at all?
I am familiar with what it is. I got to admit, some people do swear by it, but I haven't seen any research that actually backs it up for CMT or many other diseases.
We have one question here.
I really just wanted to add my comment. Somebody mentioned they were seeing an osteopath for their pain control. I did too. I spent about $4,000. My pain got so much worse with his treatment, I stopped. And he gave me supplements, and his feeling is that the neuropathy is caused by inflammation, and the inflammation is caused by gluten and dairy products. So he put me on a gluten-free, dairy-free diet, and then he gave me some supplements, and I got so much worse, and when Thanksgiving came, I said, forget it, I'm eating my regular diet. The pain went away.
Interesting.
Okay, we're
Let
going
me
to wrap
just-
this up, and I think
Let me just make a
Pat
couple
wants to
comments.
say-
Osteopathy and chiropractic treatments, which are not necessarily the same, have some benefit for some people for discomfort and pain. Again, it's not going to treat your disease. The gluten-free diet craze that this is another thing that just in the last few years, I know many people who have celiac disease. My brother-in-law, I have to make 2 different stuffings on Thanksgiving because my brother-in-law needs one that's gluten-free. I'm aware of it, and for people who have celiac disease, it's an important diet. But for those of us who are not gluten intolerant, there's no evidence that it does anything for anything. So this is another, people seem to think it's going to cure what ails you, and it's kind of this, we go through these cycles, and the evidence for these things are very small. There was a time when sugar was going to kill you. There was a time when now sugar is good for you. I mean, everything goes through these cycles. So I would just say, you're going to look at it. You're going to hope that it helps. Look at it with a clear eye and discuss it with people. My personal bias is I will let you know if it's dangerous. Gluten-free diet is not particularly dangerous. Some people gain weight with it. So it's your choice, but I think just be aware of that. Unless there's evidence, it's probably not, it may not be helpful.
So I just want to say a couple words. So it's near and dear to our heart on the physical therapy side. So from my standpoint, I've got CMT. I was told I'd be in a wheelchair by the age of 30, and that was before the gene was discovered. I know one thing on physical activity. Personally, I do P90X. Not all of them because I can't do all of those portions, but strengthening your core and keeping a proper weight will alleviate a lot of the issues. And I find myself in a dichotomy in the sense that our research platform is searching for a pill. I'm pill-free. I don't take any pills, period. So from my standpoint, it's all individual, but work on the physical aspect to the point where if it's alternative, if it's weights, if it's low impact, what works for me is a recumbent bike and an elliptical for my cardio. It's low stress, and if you look at my pretty legs, I don't have any muscles from the knee on down. So, I guess the takeaway here is physical therapy is really important. Keep the weight off. And then when it comes to all the supplements, and we're in a society where you can take a pill every 5 minutes that claims to be helpful. Maybe it is, maybe it isn't. Do your homework. We have a list of what you can and can't take or what exacerbates the neurological problems that CMT manifests itself. So, with that, I'll leave it at that, but it's a very important part. The other thing I would say is if you look on our website, we have CMT athletes. Who thought of that? Wasn't the CMTA. It was a constituents. It was a person in England who loved triathlons, something I only dream of because I can't run. But I golf and I walk 18 holes. I sport a 7 handicap. So from the standpoint, I know what works for me is keeping weight off. Everyone here, it's a major portion. But CMT athletes is everything from rowing to golf to triathlons to you name the physical activity on that, and you're going to get a chatter. Many, many thousands of people are doing that. So stay active and keep the weight off.
Thank you very much.
Thank you.